Laura, I'm sorry. I'm and it's 1:32. Why don't we begin now? Because I know time will go fast and we have
Yes.
such important things to talk about. And why don't you begin?
Hi, everyone. I'm Amin Kaur. I'm the Health Literacy Librarian at the University of Pennsylvania, Leon Levy Dental Medicine Library, and in collaboration with Dr. Glutch at the Penn Dental Medicine Community Oral Health Division and the staff at the PDM Continuing Education Committee, the library has been hosting Health Literacy Study Club, where participants read and discuss foundational and emerging research and best practices around health literacy, and patient education, particularly focused on oral health and dental medicine. I would like to thank HARC for the opportunity to model a health literacy study club discussion within the special interest group session at the conference. I hope everyone will um, enjoy the conversation that we have today. And I'm going to pass the mic to Dr. Glutch to introduce herself.
Hi, everyone. I'm Dr. Joan Glutch. I'm a professor and chief of Division of Community Oral Health and work with the both Dr. Powell and Dr. Graham and Aman in setting up the health literacy study clubs that we've had. I've had a keen interest, and actually, you may have heard, we're very happy to have a health literacy librarian at the dental school so that we can really bring the such key issues to the forefront in our teaching, our practice, and our education. I want to head it over then to Laurel Graham, who is the head of the dental school at Leon Levy Library.
Hi, yeah, I'm Amman supervisor, so I've been involved in the Health Literacy Club and generally attend every meeting, and it's been very encouraging to see some international people attend, and especially our student presenters each and every time. So I know Dr. Glutch has mentored them, and so it's been really interesting to see what the students come up with and what they present.
And then let's head it over to Dr. Powell.
Good afternoon. My name is Dr. Elizabeth Powell. I am a new faculty member at the University of Pennsylvania School of Dental Medicine. I work closely with Dr. Glutch. I'm an assistant professor of community oral health and pediatric dentistry. I'm a dual trained public health dentist and pediatric dentist, and so excited to be a part of this health literacy study club. Looking forward to engaging with everyone on this interesting topic this afternoon.
Thank you all for your introductions. So a little bit of background about the Health Literacy Study Club. I became the health literacy librarian at the Penn Dental Library in summer 2022, and in an introductory Zoom call with Dr. Glutch and the Community Oral Health Division, the idea of forming a journal club to promote health literacy discussions amongst dental students was mentioned, and um, originally, Dr. Glutch and I were planning for a health literacy study club to be virtual in the winter and then move outdoors once the weather was warmer. But during our first virtual discussion in February 2023, we had international attendees and opted to stay virtual. We realize that there are people in multiple time zones that are interested in health literacy, oral health literacy, and patient education as related to like dental medicine topics. And we've covered a wide range of topics over the past 2 years. And then starting last fall, we invited third year dental honors students to serve as discussion facilitators. And we were able to offer dental continuing education credits to participants through the Penn Dental Office of Continuing Education. Um, and later on in the session, we'll model how Health Literacy Study Club runs. We're also hoping to relaunch this in a hybrid format where in-person attendees will receive like light refreshments like tea And towards the end of the session, I'll share my email address. So if you enjoyed the conversation today, we can still engage you virtually in a future health literacy study club discussion. And I'm going to hand it off back to Dr. Lutch.
So for today's program, we wanted to model a health literacy study club. Study clubs are very popular at the dental school because we have a rich literature that's important for students to read, to understand, critique, and it's always focused, though, on the dental knowledge and skills, for example, periodontics or, radiology. And as faculty spoke, we wanted to raise interest about health literacy, patient education, particularly on oral health and dental medicine. So, like any good program, we engaged our honor students to develop a range of topics that really have hit the gamut, as Aman showed you before, from using artificial intelligence, chatbots, to care for special needs individuals. But what we wanted to look at was a multidisciplinary conversation. So far, we've focused in the dental school, and we brought to you an article today that was done as part of McGill University in many of their efforts to foster health literacy. But our goal was to reach out, especially within the University of Pennsylvania, with our nurse colleagues, our physicians, range, to begin to look at what did it mean to really promote literacy. And we wanted also to get some ideas in sharing what we did with Health Literacy Study Club. We wanted to hear your ideas and so begin to look at how we can expand for a variety of ways. Now, we began with online. It just seemed easier. We could all focus. These were lunchtime sessions. But when we did some in person, we actually got better attendance in line. So this year we'll be piloting a combination hybrid and inline. So let's actually start with what we would do in a health literacy study club. Our next slide, Alman, shows the article that we chose. This was a most recent article in the Journal of Dental Education. Bedovs and his colleagues from McGill developed a two-credit graduate course looking at the adoption of an innovative biopsychosocial approach. And as looking at the adoption, they wanted to use health literacy topics to engage students to understand social determinants of health. And we thought that this was a very unusual, really creative way. And the cartoon that you see on the slide is taken from the Bedos article. Oh, no, I'm sorry. Go back to the next one. I'm not ready for that yet. What you see here was just the biopsycho social approach. And I think it's important to ground any of our activities and now later research with some types of theoretical perspectives. So, from our point in the Division of Community Oral Health, we use the biopsychosocial models as ways to help students understand and relate to their patients. Of course, dental school is all about learning, the very specific dental techniques and activities, but it's also about learning about your patients, how best to provide dental care. And that's why using a theoretical perspective I think is really important. And when we saw this article, I jumped at the chance. We haven't used this yet. I think we will replicate this as our first in-house Penn program for the year to hear students and faculty perspectives. But what I liked about this article is not only said our our goal, we are looking to support the way dental students learn and use the biopsychosocial model. And they did it through both combination of narrative medicine, comics, and graphic novels. So there was a very detailed list. One of my favorites, I've used parts of Roz Chass Can we talk about something more pleasant as a way to talk about issues in caregiving? That was one of the readings that they chose. They had the dental students read at McGill. And based on the readings, they set up both discussion sections and reflection papers on how best students understood that. But that's the rub, because remember, health literacy talks about not only it's really focusing on how individuals understand and use information. And traditional methods of lecture, just having students read, giving exams, may not be the best for social determinants. And that caught my eye in the article because I agree with them. It's challenging. I can teach about the health of the gingival gum tissue, the diseases. We can show slides of that. But having students develop sensitivity to the range of social cultural influences and how they relate to care, that's really a challenge. um, so what this very creative group, and now we can go to the next slide, this very creative group at McGill looked at using comics, and they had students develop comics to explain their learning, to look at how they could reflect. It's one thing to write reflection papers. We do that in a variety of our courses. Ask them, how did you show empathy? What were challenging as issues with the patient? Explained how you used reflective questions. Um, but the cartoon that you're seeing here was actually written by the second author when she was a student taking the course. And then subsequently, when they've expanded the course, they've been using her comic that she wrote as a way to demonstrate her learning, communicate. And I really was very interested. If I know that some of the visual may be small, but we start with the upper left top panel. It says, first, I decided to turn the office into a uh, childlike and kid-friendly atmosphere. And you can see as a way the idea to make children feel more comfortable, to relate to them. Fish, you've been there. I know many of you, when you visited dental offices, have seen this customization. That's a wonderful way. Yeah, and so the bottom panel, the dentist is busy, using the drill, cleaning the teeth, saying, that's my job and I'm doing a great job. But then meets a patient who the patient, when they introduce, what's your name? How old are you? And, we hear right away, I have too much pain. Um, but in the bottom panel now, if we go to the bottom middle panel, the dentist is saying the questions as she starts, where are your parents? Oh, they're at work. I should go back to work soon. What, you mean school? And the 8-year-old says, no, I've never been to school. I work to help my family financially. I sell flowers on the street. I'll bring you one of those next time. So the dentist is viewing how much is going through their mind and all the question that this raises, because we see on these 4 panels on the left-hand side, that's the typical dental um, environment. That's the encounter, asking questions, providing care. Um, Yet, whoa, it's dentists can do beautiful fillings. They provide preventive care, but the on the right side, the top right panel, the thought bubbles that come out, I'll read them. He is only 8 years old. Why should a child this age work? I couldn't allow another child to grow with this, with this experiences. How unfair is this world? He needs support. I must do something. What can I do? It's time for him to enjoy his childhood, all the feelings and reflections that I think are important to understand. The student at the time was able to reflect, to bring these up, to discuss, maybe in a way that perhaps she hadn't been able to do if she had to write a 2.5 page paper or, a 300 word response. At the bottom, we have the next morning, the dentist says, I searched about community service organizations for children. I found a nonprofit looking at problem solvings, um, with a purpose. This NGO tried to educate and empower vulnerable children. Um, so was the focus, the bottom left panel focused on solutions, potentially how dentists can work. Now, I know many other healthcare situations, there is um, um, social work area. Most dental schools at this time don't have social workers. We're investigating and looking to pilot test, um, but it's not as common. The idea of social work within a dental school or within dental offices isn't as common, yet we many times see such a strong need for it. So, and go to the next slide. Um, so from that experience then, and that's how often we'll start a, a, um, uh, a session with our health literacy. Often then we move into what are some solutions, and then also group discussion. So Amin wanted to share some solutions she found about experiences with health comics. And then in the discussion portion, we'll be able to hear your examples as well. So I'm going to talk about the health comics pilot test that we've been doing.
Uh, Thank you. Thank you, Dr. Glutch, for summarizing the article. So this article inspired me to um, host a drawing health comics workshop at the dental school, and um, I held it as part of like what we call at the library crafternoons. So screen-free activities that engage fine motor skills. These crafternoons are serving as like a wellness break from a busy day in classes and clinicals for dental students, but also an ergonomics exercise for hand muscles and I thought health comics would also have a really neat tie in with Health Literacy Month. I was curious um, as to who else would also participate in this. And um, this workshop led to a new faculty student collaboration. We're in basically the ideation phase of um, creating a health comic about dental pain management. Instead of like the hand drawing, we're going to be using Canva, a web-based design software, to explore like existing comic strip templates, such as the one that is on the screen. I used a Canva template to create a comic about how to evaluate health websites and apps. We had during this session played around with some AI prompts for inspiration. And then we decided that the AI generated images of dental patients getting a tooth extraction were a bit too scary to incorporate in a comic, but we're going to continue like discussing and revising a health comic, and we're interested in pursuing an IRB approval to pilot this to obtain like real patient feedback. And this could be the start of a community of practice around graphic medicine and health comics at the dental school or at the across the university. And then I'm going to pass it back to Dr. Clutch on the
Oh,
modeling the health literacy study club discussion.
thank you. So, when we proposed and were planning for the program, we weren't sure how many people would attend. We have 18 people here. So we have small discussion breakout groups set up for that. And I'm thinking we break into two groups so that um, uh, um, Almond and I can be in one group, and Laurel and Dr. Powell can be in another group. How does that sound? Okay.
That sounds
So,
good.
but Almond, go back, go back. I want to just go back to I'm so sorry. I want to go back to what discussion questions we will use.
I'll post them in the chat.
Oh, you'll
Yeah,
post them in the chat? Oh,
yeah,
wonderful.
yeah.
Because what we'd like each group, and before did everybody go into groups yet, or?
Not yet.
Not
I'm
yet. Good. Okay. Before you go into groups, and Aman has it in the chat, we'd like to introduce yourself, really why you are interested in the special interest group. We'd like a note taker so that we can share the experiences. And we're very curious to hear those of you who have used graphic medicine, comics, graphic novels to promote health topics. And it's really in two dimensions. Our work so far, our very preliminary work has been with students and communities of practice. But I know many of you have used these with patients as well. So let us know both. But everybody, we want to look at how is this a good health literacy tool? Now, in the BETOS article, students overwhelmingly said they really enjoyed the process of drawing a comment to crystallize their reflections, to expand their thinking, to communicate the key areas that were important to them. And each student did one. So the students love to see each other. And I thought this was such a creative way of peer learning of a different modality rather than our just typical lecture. And we're curious to hear your experiences because, yes, I'm kind of embarrassed to say we do have lectures on social determinants of health, and the movies that we show are such more, we have small vignettes, some trigger tapes, we use standardized patients. We have discussion groups. Students like those so much better. And what other ways that you've used for that? And then the last one is, if we get to it, what plans do we have for discussion for promoting health literacy? What we'll do, we'll be in there for 20 minutes. So then we'll probably come back. What that will be about, it'll be what, 1:15, or I'm sorry, 2:15, so that we'll have a good like 13 minutes or so for discussion at the end. Everybody clear on our next part of our activity? I think so. So, I mean, if you can work your Zoom magic to put us into discussion groups, that would be great.
I'm opening the rooms now. And you all should be able to join your group study or breakout room. Uh, okay. And then Candace and uh, uh, Candace, I'm putting you in group number 2, and I will join number 1. Or- Okay, I think most people have returned to the main room. Um, Dr. Glutch, it looks like you're still muted.
I don't know why. So sorry for being muted. So wow, we could have kept talking, and I'm mindful of time because our session is over at 2:30. And I did want to make sure that we had time for everyone to come back and share their notices as well, their views as well. But I'll tell you, this is just what happens in our health literacy seminars, doesn't it, Owen? Last year, we ran them from 12 to 1. Students and faculty often had to get back to their clinical practice by 1. And people wanted to stay and talk. So this is not unusual. And I'm glad we chose a topic that was so interesting. In Laurel and Dr. Powell's um, uh, breakout room, who would like to report out on the key lessons and the key topics that you discussed?
Dr. Powell, do you feel comfortable? I did a lot of.
I think you did the note taking though.
I did the note taking. I did. I'm happy to. I just wanted to give you an opportunity.
Thank you.
We really engaged in it. It was incredibly fruitful. In fact, I hit the button to we need more time. We discovered one of our participants has an R1 grant and looking at health literacy images and patient education. And I'm probably doing this service to the entire R1 grant. But I was personally very interested in that. And he was talking about using different images with postdocs and patients, adult patients for health promotion, created photo novellas, and using them in social networks. I have all these little post-it notes. We also had a librarian in our group, Megan, who is looking into this, and I thought that was super interesting as a librarian myself. The fact that I think you were actually representing a government entity, if I'm remembering correctly. Is that correct, Megan? I don't know if you're able to speak. But so that was super interesting. And then the final question was, what would you do with what you learned during, this presentation? And they're still thinking, but obviously this is something that is a definite possibility. And that was a large part of this was we talked about the ability to communicate in different ways. I know some of the interesting ideas that people brought up were being able to visualize things differently, like what is a crown, how, maybe you could look at a drawing and learning about oral health that way, chair side, a lot about also language barriers. So you have the translation, but perhaps the images help in the understanding even more. So that was also a theme that came up. I don't want to run into your time. Let's see. Um, Comics. One thing that I mentioned was we were talking about what exists already in medical offices where there's posters on the wall, and all of a sudden it occurred to me that many of these posters and images that have comics or drawings in them are produced by pharmaceutical companies. So there is a challenge in that way to think about, the bias that may be involved in certain images or comics that you see. And then when we got down to what I thought was a challenging question, Michael really stepped right up and with talking about how we would apply it to oral health. He was saying, well, thinking about it systemically, like how dentists are right there to address smoking, heart attack, cancer, nutrition, diabetes, the whole systemic health. So how the comics can help in that way in reaching people, even outside of oral health. And I think my time is maybe up. So unless anyone else from my group has something to add, I will yield my time.
That sounds like an amazing conversation. We also should have had more time as well. We ended up talking, so all of us in group 1 are sort of new to graphic medicine or health comics in general, or images as a form of communication. Esther was also a librarian, and I shared her library guide in the chat. We had a wonderful conversation about children's books, communicating health information in that way. And I'm also going to share in the chat, Jefferson University Libraries has a graphic medicine collection as well. So there are libraries out there that are exploring health comics and graphic medicine and have these as a part of their collections. We also, Jessica had shared resources about Teach Back as well. So I'm going to share in the chat links to some videos about Teach Back, along with another guidebook that she had shared. And I believe we also had a clinician who talked about pictograms as a way to discuss medication information as well. I believe that was Dishanka.
Tashanka.
Yeah, Dashanka. And so it is kind of an interesting exploration as well of we had a diverse group. I believe somebody was from EBSCO Consumer Health. We have those resources at Penn Libraries, the consumer health information. And yeah, I think we can go to this slide. If you'd like
Um,
to
We had one other point I was going to bring up
Sure.
that was a positive. I mean, it was all positive about uses of this, but Michael brought up the fact that with Somali refugees, that you can tap into the positive, and the fact that people with good oral health, they feel represented in that way, and so that is a way to uh do some outreach in a positive way and to promote it, not as we're coming to fix problems or address your problems, but celebrate your health too. So there's a way that you can use the imaging in that way, in a positive.
Well, I could just share just on that
Absolutely. Please do.
on that particular project. Um, it was about refugees to Massachusetts and oral health care, and the concern was, there's all kinds of acculturation issues that have to happen, and would people come all the way towards preventive dentistry? People come from societies that don't have that, and especially kind of anyway. So and come here and get like massive access to refined sugar and whatever, all the different things that might go wrong for their dental care. And actually, we enrolled twice as fast as we had anticipated for this project, because the Somali refugees were so proud to join this project. They wanted to show us that their teeth were good and that their kids' teeth were good, and it was a matter of pride that their kids would go to school with a healthy and clean mouth and teeth. And they have a different tradition for how to. They have a miswak stick. They have a rubbing stick in East Africa that's very popular. It's a different approach to dental care, but it's effective, especially if you do it 5 times a day, which was the typical thing in this community, which is like any pro health thing that you might do that frequently is just very interesting, considering that like the average American brushes their teeth less than once a day. So anyway, so all I'm trying to say is it doesn't have to be negative all the time. It can be positive. It can be tapping into community assets and pride associated with dental care as well.
Oh, that's such a great comment. Thank you so much. Because what I really like about what we found in this just this brief time, we knew it was only an hour, and I want to get to some concluding comments. And Amin, help me out. Could you go to slide 4? Um, because I wanted to, with slide 4, go back to the article, um, the one before that. Okay, good. Um, so that we took this Betos article, and um, Michael, I was really struck when you brought up it's not just, the bad news, it's the good news, it's everything, that we're looking at a biopsychosocial approach. And that's so key to us in analyzing best practices in health literacy. And that's why I like this article so much, is that they started out with the theoretical framework, and clearly saying to students, we want to support your adoption and health in that, and then looked at best practices. They read a variety of books on narrative medicine, articles, narrative medicine, comics, graphic novels, even, as I had mentioned, a very consumer focused Roz Chast about her aging parents. Can we talk about something pleasant? But they they asked students to read, reflect, question, and then go to the next slide, Almond. A key part of their ways they worked with students is teaching them to use comics to express these very deep emotions. And I don't know about you guys, but in our group, it came out that pictures are different than words. They're both helpful. Using pictograms or some type of photojournalism, photo books, these activities, so that the students said it was so powerful. And we can see the second author's graphic that she was willing to share with us, that she had that aha moment. Isn't that true sometimes? And we talked about that. Esther talked about that in our group, that that often reading a picture book for the children, they can either vicariously experience some of the issues or have an aha moment. Oh, that's what's happened. That there are different modalities to use. And so many times, as you know, I speak as a clinician, we think about teaching and telling, and of course we use teach back. But in this, I think this article really challenged us to consider expanding our toolbox to include comics, graphic medicine, novels, because our real goal with health literacy, the emphasis isn't on us teaching. The emphasis is ensuring that our individuals are able to understand and use the information. And by shifting the perspectives, I think this was so valuable for students. Um, I'll ask my I'll ask anyone if there are any final comments. We have about a minute or so. Um, and also, I want to thank everyone who participated. Thank Dr. Powell, Laurel Graham, Amin Carr. I think we really happy with how this presented. It was a delight to meet with all of you. And Amin, put in the chat if you want to join us. We're scheduling for November. Just so you can see how we do these activities here at Penn. Amin, any last comments?
Thank you again to HARC for allowing us to model this, and I hope you join us for a future health literacy study club. It's always great to have a interprofessional conversation when it comes to these topics as well. I can also go back to the earlier list of topics that we've covered. There are some things that were covered in this HARC conference that our students have brought up, including artificial intelligence, different types of populations, that um, that and health literacy measurement tools as well. So our students are also interested in having these conversations.
Yeah.
It's open to everybody.
So,
Just a few little plugs if it's okay. So
of
this,
course.
I put my thing in it. I put you. Maybe you'll let me know when your sessions are. But there is a organization called the International Health Literacy Association. If people don't know about it, but they have a recurring journal club type format as well. If people go there, they can sign up. It's run by the research subcommittee of that organization. I have a health literacy center, and so we have a session which is more like a research in progress session for junior faculty and trainees. If people like, if people want to take it in that direction, obviously that's maybe a little different. That's fine. But I agree that interprofessional is best, and there's lots to learn from each other. And also, just you mentioned about measurement tools. If people haven't gone to my health literacy tool shed, I recommend that you go there. There are over 230 tools in the shed with multiple languages, many languages. And if you know of tools that we should be having there, please let us know. We try to look at the literature quarterly, but I'm sure we do miss things now and again, and we're aiming to keep it updated all the time. So we have multiple dental tools specifically, so you can check them out, and in multiple languages. So it's called the Health Literacy Tool Shed.
Thank you so much.
Yeah.
Thank you, Michael. We really appreciate that. That was time well spent. We are at our time. What a great session. It was great because everyone participated so well. Thanks again, and we'll continue to work together.
Thank you.
Thank you.